We will be talking about cancer and more specifically the most common ones in Marshall County. So we have lung cancer, breast cancer, and colon cancer, and these are all diseases in which cancerous cells form in tissues of either the lungs, the breast, or the colon or the rectum. This is just a brief overview of what we will be talking about. First, we have the basics of cancer, and cancer is a disease of the genes in the cells of our bodies. Many reasons can cause cancer, such as asbestos, smoking, genetics, or alcohol. There are different strategies to relieve pain besides medication and chemotherapy, such as distraction, yoga, hypnosis, or rest, and there are modifiable risk factors for cancer. So some important actions for cancer is scheduling. So if you know that there's a family history of a certain type of cancer, take it upon yourself to get screened and visit your primary healthcare provider. Monitoring. One of the biggest risk factors for any cancer is obesity, so be mindful of diet and weight. Risk factors, it's important to eliminate these in order to decrease your chance of getting cancer. So next we have signs and symptoms. For breast cancer, you may feel a lump or firm feeling in the breast or under the arm, have nipple changes or discharge, or skin that is itchy, red, scaly, dimpled, or puckered. For colon cancer, you may have rectal bleeding, discomfort when sitting, changes in bowel habits, blood in stool, or weight loss. And for lung cancer, a cough that does not go away or gets worse, coughing up blood or rust-colored sputum, or chest pain that is often worse with deep breathing, coughing, or laughing. Then we just have some important things to know and whether you are at risk. So a lot of the risk factors for these cancers, they share in common, but just remember lung cancer is more smoking, secondhand smoke, air pollution, respiratory disease. Colon cancer, think obesity, smoking, alcohol, IBD. And breast cancer, just note that this can also affect men. Then we just have some more prevention measures and how you can reduce your chances of getting cancer. So we have some screenings, and for lung cancer, they use chest x-rays and sputum cytology. For breast cancer, they use MRIs and yearly mammograms, and for colon cancer, fecal occult blood tests, sigmoidoscopies, and yearly colonoscopies. Then we just have some statistics that takes a look into Marshall County. We have the most common health behaviors. 34% of Marshall County is physically inactive, 15% partake in excessive drinking, 20% partake in smoking, and 35% are obese. Some quick facts. This is just comparing Marshall County to the United States in terms of education rates, poverty rates, people who are uninsured, and who are in the labor force. And then now we're going to be talking about how exactly the community is affected in terms of the social detriments of health. So in Marshall County, there are high rates of adults who smoke and who are obese. This is because residents who hold a higher education is low compared to the national average. Residents do not have the proper education on healthy habits. There's also a high poverty rate, and residents may not be able to afford healthier foods and much less pay for insurance for specialized services. The uninsured rate in Marshall County is at 15%, and there's also 30 to 40% of residents who do not get vaccines or screenings. Residents may not be able to afford insurance and are not properly educated on good medical habits. Also, those without insurance put themselves at risk for debt and inability to treat their condition. Not having insurance can also limit access to certain healthcare providers. And because of the high rates of residents in the labor force, they may neglect their need to go to the doctor's office due to work schedules, and this can worsen their state, and they also do not have time or make the time to be physically active. And then you can click the link below for our cancer flyer, and it just has all of this presentation summarized into a different format. And then if you have any other questions, you can visit the National Cancer Institute or the American Cancer Society for more information. Thank you.